In compliance with the instruction of the Ministry of Health and regulators around the world, we now have to ensure we cover both our mouth and nose with a face mask when leaving the house to protect ourselves from the novel coronavirus, COVID-19. Here we will get to know the most common types of face masks available on the market and learn about their pros and cons, as well as other important information. First, we will have the surgical disposable mask. Usually comes in blue or green. These are single-use masks providing 3 layers of filtration. Surgical masks are usually very efficient as they can protect up to 95% of bacteria. However, they do not protect as well from viruses such as coronavirus and smaller size particles. With regular hand washing and social distancing, their effectability increases. These kind of masks are mainly used by healthcare workers, but within times of pandemics, they are recommended for the use of public and patients with COVID-19, especially since it decreases transmission of the virus from the infected individuals to the healthy ones. They are cheap and usually available in reasonable quantities, though sometimes there is a shortage of these masks. The masks often come in one standard size for all people and doesn't require a fit test. They are also easily breathable. This type of mask is not subject to strict manufacturing standards, and because of that, some types of these masks come in less than 3 layers, and this does not provide the desired protection. Can be checked by tearing a sample of the mask and look for the middle layer of the 3. It is also important to note that in terms of the coronavirus, these masks are most efficient when used alongside regular hand washing and social distancing techniques. Second, we have the N95 or the KN95 masks. These again are single-use masks, but in time of the crisis they may be used more than once, provided that the front of the mask is not touched to reduce the spread of the microbes. These masks are comprised of 5 layers of filtration. These masks have excellent effectiveness since they protect against all bacteria and viruses, and up to 95% of all the smaller air particles too. These kinds of masks were originally intended to be used by healthcare workers, especially those who are supervising COVID-19 patients. They provide the best protection compared to other masks. The cons of this mask are that they are available in small quantities and high in price compared to the rest of the masks. Difficult to breathe in when worn and require a fit test to give you that desired efficiency. Finally, there's the homemade mask. These are made as multiple use masks, can be washed. Homemade masks usually consist of at least 2 layers, the best ones that have a pocket for the changeable filter layer inside it. It is the least effective mask type among the 3, but with hand washing and social distancing, its effectiveness increases. Its pros are that it's available in abundance, can be sewed, and can be made at home. It is noteworthy that the greatness is thickness, the greater its effectiveness. Also, it is best to include a layer of filtration inside it. Purchasable from online stores, named PM 2.5 filter layer. However, its protection efficiency is minimal, but it is better to wear a mask versus not to wear. Again, its efficiency is tied to regular hand washing and social distancing. These were the most common masks in the recent pandemic. Thanks for watching the video, and I hope you learned something new.